One of the most common conditions I see in my clinic is carpal tunnel syndrome. Carpal tunnel syndrome is very common. It presents as a whole spectrum of symptoms for patients. Sometimes it starts as just a little bit of numbness and tingling in your fingertips. Perhaps you start having a little bit less grip strength or you're dropping things. One of the most common symptoms I hear about from patients is that they wake up at night with their hand numb. Typically what happens with carpal tunnel syndrome is that these symptoms become more and more progressive and get to a point where they're disrupting you not only at sleep, but also during the day with your normal activities. So what carpal tunnel is when a nerve that comes through your wrist, through the carpal tunnel, is compressed. There's a very small space where all the flexor tendons have to go to reach your fingers, and there's a nerve, the median nerve, that is compressed. And that typically causes numbness in the thumb, index, long, and ring finger. And patients typically have progressive numbness and diminished grip strength. So there's a lot of different treatment options for carpal tunnel. One of the most common things that patients try first is a nighttime splint, or a wrist splint that keeps their wrist in a neutral position at night while they sleep. Oftentimes, if that's not enough, the next step might be trying to modify activities. Then there's potential for cortisone injection, which can be effective but can have short-term or even perhaps long-term benefits, but that can wear out. Typically, I see patients in clinic who've tried and failed these conservative options, and they're at a point where the numbness and tingling is affecting them at a regular rate during the day, and they're at a point where they need to have something done surgically. So we have a couple options for carpal tunnel release. Typically, patients either have a mini open incision at the wrist or endoscopic, which is a much smaller poke hole type incision at the wrist. And the whole point of the procedure is to take the pressure off that median nerve, to release the pressure off the nerve. And simply that entails releasing a ligament that's over the top of the carpal tunnel. It's almost just taking the pressure off the nerve so it can breathe, and you're no longer having these numbness and tingling type symptoms. And eventually you get to a point where you no longer have numbness and tingling, and your grip strength returns to a solid point, and you can do the activities you enjoy without that limitation. If you're experiencing symptoms of numbness and tingling in your hand, you have diminished grip strength, and you've tried some of these conservative measures, I'd be happy to see you in clinic at Reedsburg Area Medical Center, and we can talk about if surgery is the right option for you. We can talk through the pros and cons of a mini open type incision or an endoscopic release and see what's best for you as a unique patient.